I'm Cynthia Arsenault. I'm a family nurse practitioner and nursing instructor at Lamar State College, Port Arthur. Today, we're here at Central Mall to do hands-only CPR. We're making sure our environment and our community is well equipped to handle an emergency. We have the local state college out here. We have our community resources, our nurse practitioners, and our nursing students here to make sure our community is equipped to take care of everyone.
Why is it important to teach kids CPR?
It's so important to teach kids because they, a lot of times, may be the first one on the scene. If they're taking care of a loved one or even at a school with their classmates, the more people we have informed, the better it is for our community. We know that we can get those emergency responders there quickly to take care of somebody.
What age of the kids are you talking about to teach CPR?
So today we're doing preschoolers and up. Our mannequins are here. We're going to be talking about the importance of making sure you get on that chest cavity, making sure that you get feedback on our mannequins that let us know they went to the appropriate depth, and making sure they're just equipped in the event there's an emergency and they're talking to a 911 operator. They're not afraid to get those life-saving skills.
How many volunteers do you have today, and where are they from?
We have about 30 volunteers. Most of them are from the college. We also have some from the nurse practitioner group. We have some from B.O. Rose, a nonprofit, and from Gulf Coast Healthcare Center.
Is there anything else you'd like to add?
Yes. I think everyone should know CPR. This is Heart Month. It's February. If you're interested in us doing a class, reach out to Lamar State College, Port Arthur. Reach out to Be a Rose, the nonprofit, the nurse practitioner group, or even Gulf Coast, and we can come out and make sure everybody's equipped and informed in our community.
So you know the song Staying Alive. Staying alive, staying alive. So basically you're going to the beat of Staying Alive, okay? Alright? So it's Staying Alive. Okay, so what's the first thing you're gonna do for CPR?
First thing we're going to do is we're going to check, are you okay? Are you okay? And then we're going to proceed to checking the pulse. All right, and then we're going to see simultaneously start chest compression and call Siri to call 911.
Correct. And how many chest compressions per minute are you doing?
100 to 120.
There you go. You got it.
Already.
All right, everybody, good morning. This is Heart Month. We're supposed to have a lot more people come in, so if somebody trickles in, I may say, hey, help get your partner to where we're at. My name's Cynthia Arsenault. I'm one of the nursing instructors at Lamar State College, Port Arthur. I also am the medical director at Gulf Coast Medical Center. I'm also a part of Southeast Texas Nurse Practitioners, and I am the founder of Be a Rose. So a little bit of everything here today. But I want to introduce some of our important people that are here. This event would not have taken place without Ms. Kelsey right here with Central Mall. So we thank you so much for saying it is important that our community knows about heart awareness. We also have Judge Guillory here from our community, Precinct 2. So thank you so much. We have the Chief of Police from this great city of Port Arthur, Mr. Tim Durso right there. We have James Arsenault, who's also my husband, from the District Attorney's Office. At the Lamar State College Port Arthur table, we have some nurses right there. We have Ms. Reyes and Ms. Davis. Then we have Mr. Eddie Patton and Mr. Nathaniel. They are right there at the Gulf Coast table. And then if you look around, don't forget Ms. Mitchell, a nursing instructor, we have a lot of Lamar State College Port Arthur students here. So guess what? At some point, if you said, hey, I need help, they're available. Then we have candy at the table. So if you need your teeth taken care of, we have Dr. Hederman, the head dentist from Gulf Coast Health Center here, saying they're giving out candy, but we need to make hands real quick. Just look at your hands. Did you realize, I'm not one to say it by the phone, did you realize that your hands are built to save a life? And that's what we're going to be doing today. So when we get on the mannequin, I want you to really realize that our hands are equipped to what? Save a life, to save someone. God forbid we never want this to happen, but we want you to be well equipped. Look at your hand and look at your parent, whoever brought you, and pull your hand out, show them your fist and say, I'm going to save a life today. Mr. Elgin, I'm going to save a life today. I'm going to save a life today. We're going to use the heel of our hand, okay? So you're probably saying, I didn't think I was coming to school today, but we do have to do a little bit of introduction. So we're going to kind of tell you the importance of hands-only CPR. Guess what? We recognize in our community there are risk factors. I don't know if y'all know this, but women are very high risk for cardiovascular disease. So we want to make sure that we're equipped to take care of them in the event that something happens. So let's look at this. Hands-only CPR. What we're learning today is just for teens and adults. If you think about that. I'm going to let y'all click. So it's really just for teens and adults. So if you look at our mannequins, this is for teens. Oh, guess what? My mannequins light up. So if I know you're going to the appropriate depth, guess what? Those mannequins are going to light up right in their shoulders. Anybody light up in here? Nobody? Look around. Anybody light up in here? You light up, sir? He said he lights up, all right? But in real life, mannequins don't light up. Real life people don't light up. That's why we want to make sure we go to the appropriate depth. We go deep. Okay, we go really deep. If you think like a credit card, you know, you like to use your mom, your dad, grandma's credit card, swipe, get you some stuff. I saw him looking. He was like, I'm swiping around here. It's about half the depth of that credit card. So we're going pretty deep on that chest cavity. So you gotta what? Lock your elbows. Let me see y'all lock your elbows. It's gonna be all right. So we're gonna push hard, push fast. We also want to make sure we call 911. Today we are not calling 911. Okay, we're gonna talk about it. Everybody clear? So when I say call 911, do not call 911. But we want to call 911 because guess what? They're going to get those paramedics, those EMT, those services there that we need.
Call 911. You ready?
Be ready.
Be ready.
That's what we're going to learn today. How to be ready. How to make sure we can take care of this. How can we make sure we're ready to take care of our people? So let's go to the next slide. We're going to push hard. We're going to push fast. So now we have to get on the court and help that person. We want to get that blood flow. What does that blood flow do for us? It gets us where? Circulation. Good job. It gets circulation. The blood flow goes what? Back up our neck to our brain. Our brain tells the body everything what to do, if you think about it. Y'all see those red and pink lines? Eric, if you don't mind, if you can just kind of move around the room and let everybody see it. That are some things that I need to know when I call 911. What if I don't speak English? There's translators. So don't be afraid to call 911. Whatever language it is, they can get you some help. Who's your best friend? What color shirt do you have on? They don't ask you any of those personal questions. They're not worried about that. They just want to get help to you immediately. 10 seconds, y'all, to determine if they're okay or not. How would I know somebody's okay? Look at your neighbor. What do you see them doing? What do you see your neighbor doing? Breathing. You see the chest going up? Okay, what else? Talking. She's talking to you, right? All right, we're going to do that. Are you okay? Are you okay? You're not at work, okay? And then we're going to what? Call 911. So remember I talked about the basketball earlier? If the basketball's not bouncing, it's just sitting on the floor, right? Think about it. It's just sitting on the floor, it's not doing anything. So we want to make sure our person, whoever we're doing CPR on, is on a hard, flat surface if we can get them there. Somewhere safely, okay? If you can't get them there, they're in the car, you can lay the seat back, mom's, dad's. Okay, if they're in the bed and you can't get them out the bed, just try to pull the sheets back if you can from underneath them. Because we want a hard, flat surface when we're giving compressions. We want a fast song. What about the Twinkle, Twinkle, Little Star Get fast song? No. Twinkle, twinkle. If your heart was beating like that, that's not what happened. There's a song that a lot of the kids like, and it goes with faith. Stay alive. Very fast. That's the song you want to think of in your head when we're giving these compressions talking about faith. But while we're on the baby, would I ever shake the baby? No. Baby, are you okay? or tap the bottom of the foot. Baby, baby, are you okay? Y'all come on in. We got some, let's clap for our friends that came in a safe life setting. 7 out of 10. So where are they occurring? At the mall, at work, at church, at HEB. 1 out of 10 people survive. So today, guess what? Give yourself a round of applause. You're changing the numbers. I'm proud of y'all. Y'all are changing the numbers today. From years of hypertension not being treated, maybe diabetes not controlled, high cholesterol not controlled, and this is where the person now has a heart attack. There's a block in the blood flow. Okay, somebody has a heart attack. They presented. We have some pictures up here. They present with the chest pain, the shortness of breath, sweating. Okay, women usually don't present like this. February is Heart Month. A lot of times women just have indigestion sometimes. What do you do? We talked about this a little earlier. I jumped ahead of myself. The 911 operator will ask you where you're at. They want to make sure that you're there. Don't call 911 and leave. You think these hands can save a life? I think so. He got some pretty big hands. I think he's going to be pretty good. All right. We're going to ask him what? Are you okay? Are you okay? We have about 10 seconds, and we're going to put the other hand over that hand. I know you have a student who can help you and rock your elbow. And let's give us a baby shark area. Come on, Mr. DJ. All right, man. I think you're like a hot ground. Let's get them on. Ariel, you got it. All right, man. Give me some deep compression. If you want to practice on the baby, y'all come over here with this butler. And you're going to use the heel of your hand right here. Come on.
CPR training today at Central Mall. We learned how to save lives, how to do proper techniques on CPR. Really good family event. Appreciate y'all.
This was an excellent, fun, family-filled day. Happy Valentine's Day.